Catherine, a 16-year-old girl, was the youngest of four and the only child living at home with her widowed mother. Catherine was a gifted pianist and high academic achiever who had missed a term of school with chronic fatigue syndrome and presented to the emergency department with severe back pain and loss of gait. Extensive investigations failed to find an explanation for her symptoms. She was diagnosed by her medical treating team with a conversion disorder. At Catherine's multidisciplinary meeting, the psychiatrist explained why conversion disorder was not an appropriate label. It was agreed that pressure and expectation were probably playing a part in Catherine's presentation, but that neither she nor her mother was likely to be very receptive to this formulation. Catherine and her mother joined the meeting and were told that careful assessment and investigations had reassured the team that there was nothing dangerous going on, but there was unfortunately no convincing explanation for her symptoms, and there might not ever be. They were told that nevertheless there was a plan for management which could be predicted to be successful. The psychiatrist was introduced as someone experienced in working where there were unexplained signs and symptoms, but who would also take an interest in Catherine and her mother's well-being in the face of the disabling pain and dysfunction. There was tension between team members about whether Catherine couldn't or wouldn't walk. It was helpful to illustrate the blurring of this distinction by asking the team to reflect on their experience of struggling to run up a hill and deciding, "I can't run any further." Had they stopped because they couldn't go on or because they wouldn't? It is not immediately clear that these differ except at the level of verbal report, a post hoc rationalisation for having stopped. We agreed that in speaking to Catherine and her family, staff should not say either "she can't walk" or "she won't walk," but rather "she isn't walking."